Hi, my name is Vincent. I'm going to present a technology-assisted treatment method for the Parkinson disease called deep brain stimulation. Parkinson disease is a chronic motor system disorder due to progressive neuron degeneration of the brain, but the cause remains unknown. According to a publication by Parkinson's Australia, the disease affects about 100,000 Australians and is growing about 4% in next 20 years. There is no immediate cure for the disease. Nowadays, there are treatments focused on improving quality of life. Some of the common motor symptoms of Parkinson's disease include muscle rigidity, slow in movement, postural instability, and rest tremor like pill rolling. The objective of deep brain stimulation is to regulate the motion control by the brain to alleviate motion fluctuation for the patient, like a cardiac pacemaker doing to patients with irregular heartbeat. Deep brain stimulation involves MRI for surgeon to precisely map the brain. The electrodes are inserted to the substantia nigra. Leads are connected from the electrodes to the external pulse generator on the patient's chest. Post-operational tuning is required. Over 1,000 patients have received this treatment by the leading neurosurgeon at the University of Queensland alone. Let me explain to you why substantia nigra has been chosen for this procedure. It is part of the basal ganglia structure of the brain which control motion. It has a dopamine-generated neuron which connects to the striatum. It releases dopamine when it gets excited. Dopamine is bound to the D1 and D2 receptor of the adjacent neuron. The receptors are G protein coupled receptor, which will increase the intracellular level of CAMP to create the second message and generate action potential to deliver the message to the target brain structure. By using this process, messages are delivered to the globus pallidus and the subthalamus, through which the thalamus is appropriately excited to control and manage motion. Dopamine is a key factor in motor control for Parkinson's disease. However, when a massive 80% of dopamine-generating neuron dies, there is less dopamine in the basal ganglia system to help manage movement. The gold standard of treatment for Parkinson's disease is prescription of medications such as levodopa to introduce additional dopamine to the brain. Medication gradually lose effectiveness and patients experience more motor fluctuation, technically called more off-time than on-time. Management of dosage and timing of medication become difficult. Deep brain stimulation becomes a more reliable solution to reduce off-time by allowing reliable availability of dopamine in the system. It is achieved by regulating stimulation to the structure of the brain. In this diagram, the green line represents the excitatory neuron, red line represents the inhibitory neuron, and the blue line represents the dopamine-generating neuron. Deep brain stimulation is believed to work the following way. When a regulated pulse is initiated, the subthalamus stimulates the substantia nigra. It excites the dopamine-generating neurons to release dopamine to the striatum. The subthalamus also activates the afferent fiber pathway to achieve the delicate balance of excitation and inhibition of the globus pallidus to alleviate the motor fluctuation associated with the advanced Parkinson disease. According to Parkinson's Australia, the criteria for deep brain stimulation are patient who responds to levodopa or similar medication, or people who is intolerant to medication, or people who suffer from motor fluctuation or side effect of medication such as involuntary movement. There's no age limitation for the treatment. In conclusion, patients have benefited from deep brain stimulation treatment. Technology has advanced to help improving the procedure, for example, use of MRI and design with more reliable electronics. Rechargeable battery used and reduced needs for replacement. Researchers are trying to use this same therapy for other symptoms such as walking and balance problems. Thank you.